Hi everyone, my name is Andres Camperos. I'm a student of physiotherapy of the University Arturo Michelena. Today, we're going to talk about anatomical movements. The movements produced at joint by muscle are given specific anatomical names, often referred to as anatomical terms of motion. We usually make the assumption that the body is in normal resting anatomical position, and that joint movement occurs from this resting position. Now, we're going to explore the difference between an axis and a plane before describing different joint movement. Now, planes. There are several different planes that we use to describe the body and the movement. There are three major planes: the sagittal planes, the coronal planes, and the transverse plane. The sagittal plane divides the body into left and right half. Median plane refers to the midline. Paramedian plane refers to the subdividing one half. For example, flexion and extension of the hip occurs in the sagittal plane. Coronal plane divides the body into anterior and posterior half. Example, abduction and adduction of the shoulder occurs the coronal plane. Transverse or axial plane divides the body into superior and inferior half. For example, left and right rotation of the atlantoaxial joint occurs in the transverse plane. Now, axes. There are also several axes that we use to describe the movement of a joint. It is useful to think of an axis as a metal pole, and the joint rotating around this pole. Sagittal axis passes horizontally from anterior to posterior, formed by the intersection of the sagittal and transverse plane. For example, abduction and adduction of the shoulder about the sagittal axis. Coronal axis passes horizontally from the left to right, formed by the intersection of the coronal and transverse plane. For example, flexion and extension of the hips occurs about the coronal axis. Vertical axis passes vertically from superior to inferior, formed by the intersection of the sagittal and coronal plane. For example, left and right rotation of the atlantoaxial joint occurs about the vertical axis. Movement in an axis and along a plane. Bringing together an axis and planes, we will describe the movement we used above. Flexion and extension of the hips occur in the sagittal plane and about the coronal axis. Abduction and adduction of the shoulder occurs the coronal plane and about the sagittal axis. Left and right rotation of the atlantoaxial joint occurs the transverse plane and about the vertical axis. Now, we're going to talk about flexion and extension. When talking about flexion and extension, we are usually referring to this movement as they occur about the coronal axis and along the sagittal plane. Flexion refers to decreasing of joint angle, and extension to increasing the joint angle. Now, abduction and adduction refers to movement we made about a sagittal axis and along the coronal plane. Abduction is moving a body part away from the midline, and adduction is returning this body part and bringing near to the midline. That's the finish. Thanks for your attention. I hope you like it.